Right now, somewhere in America, a person is getting sicker, not because they ignored their symptoms, not because they skipped their medication, not because they couldn't afford a doctor. They are getting sicker because of the street they live on, the food that is sold 3 blocks from their house, the air that moves through their neighborhood, the way their city was built 50 years before they were born. The United States spends more money on healthcare than any country on earth, more than the entire GDP of most nations, over $4 trillion every single year. And yet, Americans are sicker, shorter lived, and more medically distressed than citizens of countries that spend a fraction of that amount. Something is wrong, and it is not the medicine. In 2023, the Commonwealth Fund ranked the United States last among 11 wealthy nations in overall health outcomes. Last, despite spending nearly twice as much per person as the next highest spender. Researcher Elizabeth Bradley of Yale University spent years trying to understand this paradox. What she found was not a medical problem at all. Countries that invest heavily in social infrastructure, housing, food security, early childhood support, transportation, consistently produce healthier populations regardless of how much they spend on hospitals and drugs. The United States invests the least in social infrastructure of any wealthy nation, and it shows, because sickness does not begin in a hospital. It begins in a zip code. Epidemiologist Nancy Krieger of Harvard University has spent decades documenting what she calls the embodiment of social conditions. Her research shows that poverty, racism, chronic stress, and environmental exposure do not just make life harder. They change the body at a cellular level. Chronic stress floods the body with cortisol. Sustained cortisol exposure damages the cardiovascular system, suppresses the immune system, accelerates cellular aging, and increases the risk of diabetes, depression, and cancer. Your body does not know the difference between a predator and a rent payment you cannot make. It responds the same way to both. And when that stress response never switches off, when it runs for years, for decades, across an entire lifetime, the damage accumulates in ways that no prescription can fully reverse. Look at the geography of sickness in America, and a pattern emerges that no medical textbook can explain away. Life expectancy in the United States varies by as much as 20 years depending on where you live. 20 years. The difference between a full life and a shortened one, determined not by genetics, not by lifestyle choices, but by neighborhood. In some zip codes of Chicago, Baltimore, and New Orleans, life expectancy is lower than in Bangladesh. Researcher Robert Sampson of Harvard University calls this the neighborhood effect. The physical environment around you, the quality of the air, the availability of fresh food, the presence or absence of green space, the noise level, the safety of the streets, directly shapes your biological health in ways that persist across generations. Children who grow up in high-stress, low-resource environments show measurable differences in brain development, immune function, and stress hormone regulation compared to children raised in stable environments. These differences do not disappear when circumstances improve. They become part of the body's baseline. This is what scientists call the weathering hypothesis, first proposed by researcher Arlene Geronimus of the University of Michigan. The body weathers under sustained social pressure the same way a building weathers under sustained environmental exposure, slowly, invisibly, until the damage becomes structural. And here is where it gets harder to look away. The environments that produced the most sickness in America were not accidents. Redlining, urban disinvestment, the placement of highways and industrial facilities in specific neighborhoods, the systematic underfunding of schools and public spaces in particular zip codes, these were policy decisions made deliberately by people who understood exactly what they were doing. The American health crisis is not a failure of medicine. It is the intended consequence of systems that were never designed to keep everyone healthy. Your doctor can treat your symptoms. Your doctor cannot treat your zip code, and until that changes, until the conversation shifts from what is wrong with people to what is wrong with the environment people are forced to live in, the richest country in the history of the world will keep spending $4 trillion a year to manage a problem it was built to create. The body keeps the score, and in America, the score has been kept for a very long time.